Hi everyone, my name is Emily McElwain. I'm a fourth year UVic student working on my Bachelor of Health, focusing on Indigenous health with a minor in business. Today I'll be presenting my practicum experience with BC Cancer's Learning and Development team. Before I begin, I want to acknowledge with respect that I live and learn as an uninvited settler of Irish descent, joining from the territories of the Lekwungen-speaking peoples represented by the Songhees and Esquimalt nations and Saanich peoples. OCM No Chila Cha is Lekwungen for my honorable As a student in health and Indigenous studies, I recognize the importance of Indigenous knowledge, relationships, and ongoing responsibilities in shaping how we understand health and well-being. I'm proud to learn and present on these lands. Development team at BC Cancer alongside my supervisor, Anna Fink, and my peers. My role focused on reviewing systemic therapy patient education, specifically how a pre-treatment video prepares patients for care. Now, before I dive into it, some people might be wondering what the 4 types of systemic therapy are. Systemic therapy is a cancer treatment that travels through the bloodstream to reach cells throughout the body. Some types kill cancer directly, while others block growth signals or activate the immune system. My work focused on reviewing systemic therapy patient education through an Indigenous health equity lens, with intention to how an introductory video before the first treatment sets the tone for the patient experience. At this early and vulnerable stage, education plays a role in shaping how care is experienced through BC Cancer's continuum of care, particularly in building trust, understanding, and engagement. So to guide my work, I conducted an SBAR analysis, situation, background, assessment, and recommendations. This work was grounded in public health and social policy values, particularly accountability and evidence-informed practice. What this looked like in practice was critically evaluating what information was being shared and how it was being communicated. For example, I compared BC Cancer's education approach to Ontario's Indigenous cancer strategy and applied learning principles to identify gaps in relational communication, accessibility, and cultural safety. This process allowed me to translate evidence into practical, actionable recommendations rather than just identifying problems. A key takeaway from this work is that education shapes trust, safety, and engagement. So from this analysis, I developed 6 key recommendations: demonstrating trust, respect, and listening, patient-centered communication, creating a relational and safe learning space, acknowledging Indigenous knowledge systems, supporting language accessibility, and lastly, encouraging patient partnership. These recommendations focus on improving how education is delivered rather than changing the clinical content itself. The next section will show how these recommendations can be applied in practice. So these 2 are the original smoking cessation slides taken from BC Cancer's current systemic therapy presentation. So they provide important clinical benefits of smoking cessation, but present it in a very standardized, kind of boring biomedical way. In my analysis, I found that this approach doesn't acknowledge cultural context or different relationships people may have with tobacco. Additionally, at this point in everyone's journey, it's pretty well known that smoking is a risk, especially during cancer treatment. The next slide, supporting slide, provides a range of supports, including the First Nations Health Authority. However, Indigenous-specific supports are somewhat buried in the list, and there's limited visibility or explanation of culturally relevant care. So this slide reflects our for acknowledging, sorry, I don't know if I'm on the right slide. going to wait a second. Distinction between ceremonial and commercial tobacco, recognizing that tobacco holds cultural and spiritual significance in many Indigenous communities. This helps avoid generalization and supports more culturally safe care. This slide also makes Indigenous supports more visible, including community-based resources, elders, and culturally relevant supports. This aligns with broader calls to action, embedded cultural safety, and addressing systemic inequities in healthcare, while simultaneously educating non-Indigenous patients' perspectives. I've edited the content down to one slide due to the repetitiveness of the original version, including mention that there will be additional information in the pamphlet after the presentation is concluded, because everyone's going to be in a different situation, and this is going to be an umbrella presentation for everyone that will be getting systemic therapy. So one key insight from my practicum is that clear is kind. Reducing information overload is essential to supporting patient understanding and reducing stress during this difficult and life-changing time. Knowledge areas I've developed through Health 253, it taught me how inequity is shaped by structural and historical factors, including colonialism. In Health 404, learning about the importance of interprofessional practice also helps strengthen my recommendations through communicating to explore how different healthcare roles contribute to patient experience and access to care. In my practicum, I applied these knowledge areas in my evidence-informed SBAR by identifying how current patient education may unintentionally exclude diverse patient experiences. Communicating with my peers allowed me to integrate recommendations directly from the nurses who were currently doing the patient education presentation this past month. And one area I'm most proud of is applying Call to Action 19 from the Truth and Reconciliation Commission. This calls on health systems to identify and close gaps in health outcomes and improve equitable care. Moving forward, I will continue to guide my work by reminding myself to consider systemic barriers when interacting with the community, prioritizing culturally safe care, evaluating practices, programs, and systems to ensure that they are equitable, and always speak up to advocate to improve systems. One thing I didn't have mentioned in my notes, but I really appreciated that Fawn said, was the importance of building relationships. And lastly, I'd like to thank my supervisor, Anna Kavink, my professor, Natalie, my peers, and the BC Cancer Learning and Development team for their support throughout this practicum. This experience has been incredibly valuable in applying public health knowledge to real healthcare settings. My practicum has brought my degree full circle, deepening my understanding of holistic health and shaping how I approach learning development and reflection in its entirety. It's been incredibly empowering and has given me a strong sense of pride in the work that I have accomplished. This journey has been a reminder that learning is dynamic and sometimes uncomfortable, and that embracing it with openness and humility is essential to meaningful growth. I've also included a visual reminder for myself to always be open to learning new things and embracing opportunities. And I'd be happy to answer anyone's questions now.